Well, I think it'll work.
Okay, here. Okay, you did.
Okay, let's try it again. You ready?
Okay, you're good. I can't hear nothing there.
Okay. We'll try it on this other side, okay? You're doing good. Oh, messed that one up. Okay, sit up just a little bit for me.
Okay, you're nothing. Okay, you're nothing else.
Okay, good, good. That's good, and it should be a difference. There should be a difference in the time. So the other thing I'm going to do is I'm going to tap it again, and I'm going to put it on the top of your head. Okay, I know it's going to feel a little bit weird, and you're going to actually feel some vibrations, and I want to see if you feel them equally in both sides, okay? We're just kind of checking to see if you feel the vibrations in both sides, or if one's more than the other, okay? Can you feel it in both ears?
Can't hear nothing there.
Could you feel it in both ears? Okay, good. Wonderful. Wonderful. I have here a reflex hammer to check your reflex and stuff, but because you're on a blood thinner, Xarelto, I'm not going to actually tap you with the hammer because I don't want to make you bruise. But just for the video purposes, I would check your reflexes at your arms, check your tendons, just for your reflex. And I would also check them here and here, but I do not want to hit you with the hammer because you're on the blood thinner, and I do not want to cause you any pain or any bruising. So now, I actually have another piece of equipment that I need to grab so I can take a look into your ears, okay? It's called an otoscope, and I've actually got it charging in another room. I've got it plugged up. So let me go grab that so I can take a look into your ears, okay? Okay, here we go. Just going to put it together here. Make sure that it is working. Well, there we go. There we go. And there's some covers for this, okay? And what I'm actually going to do is put this in your ears. And it's going to be a little bit uncomfortable, but it shouldn't hurt. It's just probably going to feel funny. And I'm going to, so I can take a look in your ears. I want to make sure there's no redness or anything, no fluid or anything in your ears. So let me just make sure you're good to go. I'm going to look at both sides, okay? So I'm going to pull your hair back here. And I apologize if it's uncomfortable for you. Inside. Got a little bit of earwax in there. Oh, it looks good. It's like a grayish color, which is normal. What we want to see. Gotta get some of that earwax out, man. But we can work on that. Same thing with the other side. Looks good. It actually looks like you might have some little bit of fluid behind this ear. Have you been congested or anything lately?
No, I don't think so.
What were your sinuses or anything like that been there? What side do you normally sleep on? You normally sleep on that side at nighttime?
Most of the time.
Yeah, it looks like you might have a little bit of fluid in your ears.
What would cause that in your ear?
Well, it could drain and stuff sometimes. Like, that's why I was asking if you had any sinus problems or something that was causing some drainage in your, because sometimes our sinuses, we have some eustachian tubes, and our ears, nose, and throat, they're all connected. And sometimes that can cause us to, the fluid in our sinuses and stuff can drain into those eustachian tubes and stuff, and it can get in our ears. But it looks like you do have a little bit of fluid behind that ear. I noticed you were taking some antibiotics. This is a light I'm going to shine in your eye. I'm just looking into your pupil, okay? So if you'll just, again, focus for me on that wall over there. And making sure you have a positive. It reflects. And you do. Good job. The other thing I want to do is, if you will, for me. You see that wall? I want you to look up. Actually, you see that statue up there on the wall? I want you to look at that statue for me, okay? And focus on that statue. And then I'm going to bring a pen up close to your face, and I want you to focus on that too. But right now, I want you to just focus on the wall. Okay?
On the wall?
Mm-hmm. Yeah, that's about 10 feet plus away. So let's just focus on that. Focus back on the wall. And then look at my pen. Look at the wall. Now look at my pen. I'm checking to see if your eyes are accommodating from distance to close vision. The other thing I want to do is I'm going to have this pen, I'm going to bring it in close, okay? Almost to touch your nose. And I want you to follow this pen. I just want you to look at the pen, okay? Now, when you see double vision, I want you to tell me now.
I see double.
If you start seeing two pens. You see two pens?
Mm-hmm.
Right. So as soon as you start seeing two pens, I want you to tell me, okay? Say now. No. Okay, good. So we've done your head, we've done your eyes, we've done your ears, we've looked at your mouth, your mucous membranes, everything. The next thing I want to do is listen to your lungs, okay? So I'm going to listen to your front and your back. So I'll tell you to take a deep breath in and out, and I want you to big breath in, big breath out, okay?
Do my best.
All right. Okay, can you sit up for me? And I'm going to be touching a little bit on your chest and on your sides and stuff, okay? Big breath in. Good. In and out. Good. Go into this one here. In and out. Good job. In and out. Just slow, deep breaths. In and out. Come on. Listen to your neck. We have some arteries that are in our neck, and I just want to listen to those arteries. Okay, I'm going to flip my stethoscope around, though, to listen to that part, so I can hear it better. I'm going to do one side at a time. You can just breathe normal. Your airway sounds good there too. Listen to your heart real quickly. I'm going to check your pulse in your hand while I listen to your heart, because you have an irregular heartbeat, and I want to verify and that you're getting good perfusion. I'm going to stick my stethoscope underneath, okay?
All right.
That's okay?
Yeah.
Make sure. Twist around so I can hear it on that side. Your heartbeat's irregular, but it's not. It's not as irregular as I would have thought that it would have been.
Well, I can't tell you that.
Yeah, I bet you can. I bet you can. Do you ever feel like it's racing?
No.
No? You mind if I pull your sleeve up? I want to take a look at your skin, too.
Oh, you took that off.
We can take that off.
That's where she stuck me yesterday.
Oh, she stuck you, because I'm going to go ahead and take that off then, okay? I'm try my best. Be careful with your skin, because your skin is so thin. Just going to feel your pulses here, too. I'm going to set that there. We'll throw that in there. You got good, strong pulses. You can just relax your arm. You have good, strong pulses.
Yeah,
Skin's very thin.
it is.
Got a lot of bruising on both arms. But now you do take that blood thinner. Your skin's a little bit dry too.
Yeah.
It's not hot. Can you squeeze my hands for me? Good job. Good job. Can you put your hands on your knees? And I want you to really try and raise your arms up against me. Pull hard. I want you to raise them up. Good. Good. Can you take your arms and follow me? Touch your nose. Like, bring your arm out and touch your nose. Good. This side out and touch your nose. You don't have any problems with. I want to look at your shoulders. Raise your arms up for me. And bring them out and down. Does that hurt?
No, it's just, this is just sore a little bit. It's all. I mean, it's
So raise your arm again for me.
it don't hurt or nothing like that. It's just.
Where? Show me where is it sore. Here.
If I move it up in the right up in there somewhere.
Here. It's tight. That muscle's tight.
I mean, it don't hurt when you mash it.
Now go down. Raise it up. Trying to check your muscles flexing. And down. Okay, that's good. Look at your finger. You have beautiful fingernails. And a good capillary refill. Okay. Good. Good. I'm going to listen to, well, actually, before I listen to your abdomen, can you come back and lay down on the couch for me? Let me move my equipment out of the way. I want you to lay down.
Which way you be laying?
Either way, let me get you a pillow, actually. Here. So I'm going to look at your legs, too. You can go, just relax. Go ahead and lay on back for me. There you go. I'm going to raise your shirt up, okay? But again, no one is going to be watching this except for myself and my instructor. So I'm going to look at your belly. I see that place there.
It looks better.
It actually looks like it's healing.
Yeah, she said it looked.
I'm going to measure it, okay? I'm going to measure it. 3 inches wide, long, about 1 inch wide. Okay.
Hello. Huh? They're covered up. What might be good.
I'm gonna listen. I'm gonna listen to your belly. Okay.
Okay. That's all right. You don't see them no way. What? You don't see a thing.
Look, listen, and feel. You hungry?
Nobody's got where my stomach growls. It ain't me hungry.
Because you got some food in there.
Yeah.
When was the last time you had a bowel movement?
Yesterday.
Okay, good. I'm listening on this side too. That one really does look better.
It does.
It looks a lot better.
I ain't looking at my arm on the head too.
Mm-hmm. You see, I'm gonna press here. Is that any pain?
Mm-hmm.
No pain? There?
Mm-hmm.
What about here? This is your bladder here. You have any problems going to the bathroom?
Mm-hmm.
Any pain?
Mm-hmm.
Want to press there? How often do you go to the bathroom?
Lord, I go 3 or 4 times some days.
Well, to urinate, to pee.
Yeah, to pee.
Mm-hmm.
Sometimes I go twice.
Okay. Can you press your feet down? I want you to press your feet down. I'm going to put my hands against it like you're mashing a gas pedal, okay? Press. Good job. Now I'm going to put my hands on this. I'm going to take your toes and pull it up to your nose.
Pull it up to my nose?
Yeah, look, you're pulling it up there. Pull your toes up. Good job. Just look at your legs. It looks like you got a little bit of swelling here in your legs.
Well, don't usually swell. How come it's swelling when...
Well, sometimes, you know, with older age, and if your legs are staying down in a dependent position, sometimes that can cause your legs to swell a bit. Let me check your feet.
My feet cold.
They are cold. Are they cold?
After you hit them with your hands, I felt, because your hands is warm.
Uh-huh. You got a good pulse this time. This where you fell yesterday?
Yes, it is.
I just want to take a look. I'm not going to unwrap it. We'll change
Probably
that
dry
dressing.
because I ain't put no cream
We'll
on
change
it.
it. No, they actually, your skin is very nice.
They look like they're getting a little bit bigger.
Yeah. This may feel, I'm going to grab my hammer here. You may feel like I'm just checking a reflex. You may feel like it tickles a little bit, okay, but I'm just going to check here. Good. Good. You go ahead and I'm going to put these socks back on you, okay? You have just a little bit of swelling in those feet. But again, that can happen with age. Your toenails and stuff look good too. Pretty painted red. All right, if you want to, can you sit up for me? Can you stand for me? I just want to check your gait, but I'm going to walk with you, okay, because I want to make sure that you do not fall. So we're just going to walk across the room and walk back because I want to watch you as you walk. Okay, you can turn around. Do you have any problems getting around at home?
No, I sure don't.
Oh, good, good. You don't use a cane or anything like that when you're walking?
No.
Okay. Well, good. Okay, my gloves here.
I just try to wear good shoes.
That's important. That's very important, especially for someone at your age, to make sure that you have good shoes that support you whenever you are walking and stuff. So, do you have any more questions for me, Miss Garrett? Because I think, overall, you're actually in pretty good health.
Well, that's
with
good.
a few things, one thing I would encourage you to do is we'll really try and work on the nutrition. Did you tell me how much you weighed?
82.
82. How tall are you?
Is it 5'1", 5'2"? I'm not.
So you're about 61 inches. One thing that we look at with patients' weight is not even so much their actual weight in poundage, but their body mass index, right? And it really, because your muscles and stuff, you see, you got a lot of loose skin and stuff here too. And I felt your muscles when you're doing your movement and stuff, and your muscles are able to support your weight. So, but sometimes one thing that we get older, we lose our muscle mass when we get older. That's why it's really important to make sure that we're having a good amount of protein. And the other thing is calcium. Do you take a calcium supplement every day? That's one of those things, especially since you've had a hysterectomy, that we really want to make sure that we're monitoring is your calcium intake and making sure that you're following up with your primary doctor. So, because some of those medicines you're on are really dangerous medicines. We want to make sure that we're keeping a good check of your blood work and your labs and stuff. Make sure they're not getting to a dangerous level with your medicines. But your BMI based on your height and your weight is very low. Very low. So one thing I want to really, it is to the level of being anorexic. And so we want to really work on your nutrition and making sure that you have good nutrition, because that's going to give you energy.
Yeah,
so you can do something, because that's what you said. And then what you said, you want to be able to do things, So, and we want you to be able to do things too. And that's our goal, is to keep you at your optimum level of health. So thank you so much for coming in today. If you don't have any more questions, thank you so much.
Thank you.
And like again, I said, the only person that will be reviewing this is myself and Dr. Hummer, my faculty member, my teacher. My teacher, she's going to be grading me. And I'll do a reflection. But I also would like to ask your permission to maybe come in at the end of the semester and let me do a second health assessment on you live in front of my faculty member. Would you be okay with that? That'll happen probably in a couple months.
Yeah, I think I could.
Okay, great. Well, Miss Garrett, thank you.
Thank you.